So a lot of the headaches we treat are cervicogenic headaches, which means that they're headaches, but they're coming from a problem in the neck. The most typical problems in the neck that cause headaches are either muscle spasm, what's often called a tension headache, and also from facet joint pain. So some of the joints in the upper part of the neck can directly cause headaches. And it takes a careful history, physical exam, and exclusion of other sources to determine that the headache is actually a cervicogenic headache. When we treat those, we have to treat the cervical spine or the neck in order to get relief of that headache. Another type of headache we commonly treat is occipital neuralgia, and that's where you have pain from the nerves that go up the back of the head. And that can be very effectively treated with injections of the occipital nerve area. The technique that I use in this practice to block the occipital nerves is using ultrasound guidance. It's important to identify the central canal because you don't want to inject any medications into the central canal of the spine where the spinal cord lives and the cerebrospinal fluid is. It's a serious complication if you get it. In addition, you don't want to inject directly into the occipital artery, which is also in the vicinity of the occipital nerve. With ultrasound, it's an excellent technique because you can visualize these structures and often identify the occipital nerve and the occipital artery and make sure you get the medication right next to the occipital nerve, avoiding the artery, and you can use less medication to do the injection. An interesting thing about a variety of headache conditions is that, for example, cervicogenic headaches or occipital neuralgia or almost any type of headache can be a trigger for migraine. So patients that have migraine headache disorder already can have a variety of triggers. They can have dietary triggers, they can have environmental triggers, but also in some of these patients, they have a particular trigger of another pain condition. So for example, their neck pain flares up, they get spasm of the muscle and a tension headache, and that triggers a migraine. Very often we can get better control of their migraines if we figure out what's triggering this other headache that's causing the migraines and treat that.